Hello, everyone. Good to see you all today. And all of the squares on Zoom. Thank you. Thank you for joining us. We've got a good turnout. Thank you. So my name is Mary Fox. I'm an associate practice professor in health policy and management and jointly appointed in environmental health and engineering. I am an associate director of our Risk Sciences and Public Policy Institute. And this term, I'm also co-instructor for the injury seminar. And today is a joint session of the regular ERC monthly meeting and the injury seminar. I'm glad to have you all here. And I'm happy to be here. I'm sorry that we don't have Mike Wright here with us. Unfortunately, he, as of late last week, he is dealing with an urgent medical issue. He hurt himself and has some kind of a fungal infection, and so needs to have that attended to. And so I'm hoping that we may be able to see Mike another time. I was looking forward to meeting him in person, actually, because I've only seen him online. Both of us serve as advisors to EPA's TSCA program on the Science Advisory Committee on Chemicals. So it is disappointing that he's not here, but thank you all for joining. And I will be talking today about work that I have done over the past 10 years or so with colleagues at NIOSH, focused on what does occupational epidemiology tell us about cumulative risk for workers. And I will start with a little bit of just sort of background and development on cumulative risk. And for those of you who have taken the risk class, I promise there's some new stuff in here. You have not heard and seen all of this. So a little bit about cumulative risk, where it came from, the developments over time, and then diving into a couple of these projects that I've done with my NIOSH colleagues. And so a useful figure to keep in mind as we go through today is the one here, which was published in one of these first collaborative efforts with some folks at NIOSH, focused on, as you sort of see these overlapping concentric circles here, and the one highlighted in the figure is the occupational sphere. And of course, we're going to be talking mostly about workers, that's our focus. But, you know, workers live in the world, right? They are part of a community. They have families. They interact with the ambient environment as well as the work environment. And that's what this figure is trying to capture here. And potentially we have, you know, we as workers and people living in this world, right, inhabit all of these different environments at different times for different amounts of time, and are then subject to potential environmental and other exposures that occur across all of these different spheres. So that's what we're trying to capture here, and that's kind of the basic concept behind the term cumulative risk. And just a note about risk assessment and occupational risk assessment. So in 2020, NIOSH put out a kind of a compendium report about their risk assessment practices. And I'll just note sort of this first line from the forward of this report is that there is a pressing need for risk assessment, particularly of chemical substances. And as far as I know, and as of September, when I checked the website yesterday, John Howard is still director of NIOSH, hopefully for many years to come. But and we know, of course, that NIOSH has gone through a lot of changes, has been a lot of disinvestment, has lost many workers. And unfortunately, most of the people that I have worked with on these various projects over time no longer work at NIOSH. I think a couple of them still do. But, you know, that statement from Director Howard was about chemical substances. But of course, if we think about that overlapping, you know, those overlapping circles again, we are not exposed only to chemicals. We're exposed to biological stressors, physical stressors, psychosocial stress, and others, man-made and natural, right? So our life presents us with these many stressors in different combinations at different times. And so we use something called the risk assessment process, and many of you are very familiar with this. I'm doing just a teeny bit of introduction here for some of the injury seminar students who may have not taken the risk assessment courses yet. So the process we use, this 5-step process here, is very common in environmental and occupational health policy, food safety, drug and product evaluations, many contexts and applications. But it was designed and developed really to look at one thing at a time, one chemical at a time, whatever. Pick your stressor of concern, noise. We tend to do things one at a time. In the past 20 years or so, we've had more attention to mixtures. We've had more attention to this cumulative concept of combined hazard exposures. We haven't been very successful in implementing it across many applications as of yet. So I'm going to bring you kind of up to date, at least on my perception of this and some of the work that I've done in this area in the talk today. So what do we use risk assessments for? And again, this is just a very briefly to try to give you a sense of how useful this risk assessment process is, right? We use it to set many types of guidance, standards, in both the general environmental health realm as well as in the occupational realm. And just sort of a few examples here on the slide, just to get people thinking about how we use risk assessment to set water standards, which are maximum contaminant levels. We use the risk assessment process to set soil screening levels for different types of spills and cleanups. And just a couple of examples again of occupational exposure limits, or OELs. So the first work I ever did with NIOSH was on this first type of OEL, the immediately dangerous to life and health values. I'd peer reviewed a set of these as they were updating them, and this started about 10 years ago. And that was a couple of years we were working on that. And then one that is likely more or as familiar, if not more familiar to many, is the PEL, the permissible exposure limit. So let's just to give you a little bit of a sense, and again, mostly for the injury seminar students who may not have had this content before, just to give them a sense of it. So when I was starting my research career, EPA put out this, I kind of call it a vision statement. The full document title is Cumulative Risk Assessment Guidance for Planning and Scoping, but kind of a vision statement about cumulative risk. And, it has some useful definitions here. So it's about real life complex exposures, right? Chemical and non-chemical stressors. And the idea was that we would be able to use this more holistic approach to, address community concerns, right? And do more holistic risk reduction. And the stressor examples they list in this report, these 10 here, ranges from several of the ones that I had on the slide, a few slides ago, but also land use changes. They're speaking to both the ecological risk field as well as the human health risk assessment field. But of course, that cumulative concept even, had background even before then. So that was the late 90s, right? the idea of cumulative impacts was built into the National Environmental Policy Act in 1969. It's sort of an idea of cumulative impacts for a specific type of project. And that had a time component, right? You have a new building, build a new road, whatever. There's going to be impacts that accumulate over time. Chemical mixtures were a big issue again, and I apologize. This comes primarily from the environmental health side, at least initially. But we'll see after that 1997 guidance that I mentioned a minute ago, both EPA and NIOSH put forward definitions, sort of further refining the idea and kind of how they would be thinking about it. On the part of NIOSH in 2004, they put forward a definition of mixed exposures, which included chemical mixtures, different agents at different times, chemicals and other stressors. So very much aligned with what I've been presenting and orienting you to from the kind of the EPA side of things. And so since then, so that's 20 years ago, there have been developments, conceptual developments, mostly some practical developments. In the late 90s, again, EPA was starting to do their first cumulative risk assessments of pesticides. And those are primarily, big mixtures of pesticides that are found in foods. And, the National Academies has gotten involved in this, as you might expect, in kind of the late aughts with a report on phthalates, and in the Science and Decisions report also addressed cumulative risk assessment and how to further the practice. In 2020, so I mentioned this report. This is the report that had Director Howard's statement in it. It also had a statement about cumulative risk assessment, which I will say was underwhelming because it occurred in Appendix C, which is the last page of this report. It says that NIOSH is kind of interested in this. I'm like, okay, great, thanks a lot. You're interested? Okay, well, let's see what we can do about that to try to advance it. So what I'm be presenting in the second half of the talk will be some of the work we've done to try to elucidate this and put some data, put some examples to what cumulative risk for workers is really like. Others are doing this kind of work. I really love this this paper from NASA. Again, this was in 2020, talking about the space exposome. Of course, people here at the school are working on the exposome for the rest of us. I use this example from NASA though, because that is a very specialized worker group, right? Astronauts. There are not very many of them, but they take on very extreme work in sort of extraordinary hostile environments. And so again, this space exposome idea is a cumulative risk approach from my perspective anyway. And this work was done in preparation, as we're thinking about a Mars mission. EPA in 2022 introduced a sort of a new twist on the cumulative concept called cumulative impact assessment. Really focused at the community level, but very much along the same lines. We're talking about chemical and non-chemical stressors. We're talking about multiple environments. And interestingly here, there's a nod to we shouldn't just be worried about stressors, but also stress mitigators, in fact. Other parts, and that document, the cumulative impact assessment document, was released from an office that no longer exists, right? The Office of Research and Development. An office that still does exist is the a program anyway, the Toxic Substances Control Act program, which has also been working on a cumulative risk assessment approach, which they released their approach in 2023, and just this year put forward, and our committee has reviewed their assessment on a phthalate mixture. And one of the key features, in addition to the mixture of the selected phthalates, they are going to use NHANES data as a way to bring in sort of the everyday exposure to phthalates, which is that's a new thing. They have not done that before.
Before NHANES? Those pies?
These pie charts represent some of the NHANES data. So it's an analysis of the NHANES data that the TSCA program has done. They're looking at, I think it's just one cycle of data that they had built into this initial assessment. The science advisors said, maybe you should use more, you don't just have to leave it at one cycle, there's more out there. But anyway, so this figure comes from their draft assessment. And it's just showing some of the different exposure profiles of the phthalates for different groups. I think that these are all women above, sort of looking at differences by poverty and also socioeconomic status. And you can see, looking at these different pies, that, depending on these, categories, there's slightly different exposure profiles, right? Slightly different combinations of the phthalates that you would see, right? And women of reproductive age are one of the populations of concern for phthalates and the potential reproductive issues for the developing fetus, actually. So, but just another example. So cumulative risk is not dead, right? It's advancing in little pockets here and there. TSCA is one of the programs that's still thinking about this, trying to implement it. And then just last month, the National Academy again has put forward a report on cumulative impact assessment, which draws heavily from health impact assessment. If anybody of you are familiar with that, sort of that public health approach, health impact assessment, this cumulative impact assessment framework that the National Academies presented borrows very heavily from that, but focused on environmental health issues primarily, puts forward an approach for it with, and specifies the things you should be thinking about as you take on each step. From my perspective, I think the most important thing here is the fact that we need to attend to the baseline health status of, of whatever the community, the population of concern is. I think when we start thinking about risk assessment and we think about chemicals in particular, we're sort of in this kind of abstract space, and we figure out, well, how do we measure it? Where are we finding it? Can we find the dose response data, right? But in real life, right, the exposures are happening to people in a place or workers in a workplace. And there's some baseline health issues there, right? We're not a uniformly healthy population. And people with different pre-existing conditions, for example, may respond differently to a particular chemical or other type of stressor. So from my perspective, I think if we really we can make some headway if we are thinking about, what's going on at baseline, and then thinking about, okay, so what are the other exposures, what combinations, and so on. We'll be making better public health decisions that way. But as that was very, very new, right? That only came out, the release for that was less than a month ago. So, you know, that will take some time to kind of diffuse and disseminate out into the field. So I want to close this introductory section and give you my take on cumulative risk and cumulative impact, because you may be scratching your head like, what's the difference? I have heard, you know, in different contexts, and this seems to ring true to me, that the idea of cumulative risk assessment is kind of a top-down policy tool. Like, you know, EPA would like to be able to use cumulative risk assessment to improve their policies kind of at the national level. And cumulative impact is very similar, but it's the bottom-up part. So we would be working in particular communities, potentially particular workplaces, and, you know, doing a very similar, like thinking conceptually in a very similar way. What are the combinations? But it's build it into a policy that will apply across the country, across a state, for example. And cumulative impact is something that happens more sort of community by community. But we're trying to do the same thing, right? to preserve our environment, protect human health. And we can use it to protect worker health as well. Before I head off into the other part of the talk and talk about some of these recent reviews that I've done with NIOSH colleagues, I just want to say, this is a stock photo, right, of a worker. And I had to dig through so many to find a worker actually working and with what I consider to be like adequate PPE. So, right, so this guy he's got eye protection. I think he's got hearing protection on. He's got gloves on. He's got a mask on. Mostly you see there's guys with hard hats. Well, the Zoom people may not be able to see me. Guys with hard hats standing around like this. Or standing in the middle of a work floor, just not doing anything. Of course, there's many photos of office workers and like us in whatever research meetings and things like that. But anyway, I just wanted to say it took me a long time to find a worker wearing PPE. Does anybody want to offer what else this worker could be doing to protect himself? Sleeves, yep, okay. Yeah, exactly. Or a face shield, right? So I have to say the first one I found and I put in the talk was somebody doing like working with hot metal, right? Had a molten metal thing and was about to pound on it with a hammer. No PPE at all. Like, well, no, that's not true. Had gloves on, but no eye protection, nothing, nothing else. I was like, wait a minute, this is a bad picture to include in the talk. So anyway, so I've given you kind of a background on cumulative risk and cumulative impact. It is mostly applied and has been applied, I would say, in the general environmental health space. Not so much in the occupational realm yet, which inspired the next series of slides I'll present on projects that I've done with colleagues at NIOSH to try to bring some data to this question, like, well, okay, what are the cumulative risks workers might face, and what does the research literature tell us about those things already? And the first one I'll present was a general scoping review about sort of any combined exposure and risk for workers in a workplace. And we focused that one on studies that presented some kind of formal interaction analysis. So that's the first one. And the second one I'll talk to you about is the one that it's basically done, right, and written up. But unfortunately, there is one of the co-authors who still works at NIOSH, and we have to go through agency clearance. and that is on pause at the moment, right, because of the shutdown. But the second one is about heat and other exposures. So my shorthand for that was heat plus. And we didn't limit that one to interactions. We looked at, combinations that might have been presented with stratification, also interactions. So the second one about heat is a little bit broader, well, for a couple of reasons, but that will be clear as we move along. So this first effort to gather sort of the evidence around cumulative risk for workers, I wasn't part of this from the beginning. I kind of joined later on as they were trying to analyze the data and figure out, what to say, what to present. And I would have said, if I had been involved earlier on, I would have said, just one database is not sufficient for a review, and you need to do more than, but they had done just a review with PubMed. But even so, right, a PubMed search netted, 2,300 articles that we reviewed, with our inclusion exclusion criteria, focusing specifically, as I said, on formal interaction analysis, and ended up with a data set of about 32 articles covering many types of workplaces, manufacturing and service, healthcare, military, with combination hazard exposures, right, in these 5 categories. So chemical exposures and personal risk factors, chemical exposures and biological stressor, physical and personal, as you see, psychosocial and personal, and then physical exertion and psychosocial. And I know this table is probably difficult to see. The overwhelming majority, half of these articles, were some type of chemical exposure plus a personal risk factor, such as smoking. Is a very common one, right? Also age of exposure. One looked at diet and whether sort of amount of saturated fat intake. But this sort of gives you a sense of what was in this data set. Primarily, as I said, the chemical and personal, but a few things in some of these other categories. And of course, as you might expect, also a very broad range of health outcomes. Maybe most interesting is the next slide, which captures the very highest risks that we were able to glean from that review. And there are more than this. I'll refer you to the article if you want to look at the rest of it. But and some of you are probably familiar with this very highest odds ratio that was reported in literature, looking at vinyl chloride exposure and personal risk factor, which was hepatitis B and liver cancer. So that's a very famous, well-known example of a combined exposure with astronomically high, right, difference in risk. But solvents play a big picture and, have a big role in the story. So many of the highest risk combinations that we found in this review were solvents. Solvents and noise. And then so the other ones here, we have a couple noise and smoking, we have dust and smoking. So not a surprise in looking at the exposures we see here, but maybe a surprise to actually see the sort of the extremes of the risk differences. And within this whole data set, right, there are some very modest risks in the order of, odds ratios of 1.4 all the way up to over 100. So it's there's a lot here actually, right? And if we're not really paying attention to it, we're missing a lot of potential worker risk. So these were the highest risk sort of signals, I would say, and I excluded smoking from this list. But the solvents and pre-existing disease, solvents and noise. And in fact, I think the NIOSH recommendations about ototoxicity, so preserving hearing, actually has built into it some of this understanding that noise and solvent exposure and noise and certain drug exposures do increase risk. So there certainly is, and I would call that's a cumulative risk thing that they've built into their the way they think about prevention. But an interesting one, right, kind of on the psychosocial side is the last bullet here under the high risk combinations about female military reserve officers were at highest risk of mental health problems compared to male officers or enlisted. And so that was that has to do with their psychosocial work environment and women in leadership roles not being, I don't know, or, at increased risk for mental health issues, just sort of due to, I think, the structure of that environment. So that was the first one. And now moving on to the more recent one about heat. And remember, this one had a broader
Question, can you,
Oh,
from the
yeah, sure, go ahead.
Hollywood Squares. Hi, this is Matt Stewart. They didn't consider alcohol use in the prior study. I noticed smoking and, obviously the correlation between alcohol use and carcinogenesis. I didn't see that on the slides.
Right, so that didn't show up in the, sort of our data set at the end of the day after we had, gone through the inclusion exclusion criteria. The fact that we, that data set was limited to formal interactions is one of the reasons that really limited the kind of the scope and the topics that were covered. And another thing, as I mentioned, right, they only looked at PubMed. They did not do a broader search. So I think, in my practice, a reasonable search, we have at least 3 databases, right? And so if you just search one, you're going to miss some things. So that's a great question, Matt. But yeah, no, that alcohol combinations did not come up.
Okay, thank you.
Yep. So thinking about heat, OSHA has put forward, a proposed rule about a heat standard, right? And there were hearings and public comments until very recently. So public comments closed at the end, like last week, the end of October. We'll see what happens to this, right? I don't think this administration is super interested in this kind of thing, but we'll see. And the review that we did is basically a follow-up to the 2016 heat and hot environments criteria document that that NIOSH released. And the lead author of this criteria document, Brenda Jacklish, is a colleague on this particular review. Kind of driven by her interest just to see sort of in the past decade or so since that report, what's out in the literature. And with this kind of cumulative risk lens. So this is just a quick summary of our PICO statement for this review, which was facilitated very kindly by informationist here at the Welsh Library, but included PubMed and Bayes and Scopus. And we looked broadly across different populations, not just workers this time. Actually, any epidemiological study, right, of working age people was included here. And any quantitative comparison, right, that might have been reported in the paper, not limited to interactions. So we also looked at stratified analyses, effect modification if they reported that way, and interactions as well. Although in this data set, we'll sort of talk through how we screened it and what we ended up with. Relatively few interaction studies, at least because I'm going to focus in on outdoor workers. So very few in that context. This is a broader, this was a pretty broad review, right? So we have a lot of data here. And these are just a couple of the ways we tried to organize things. There's hundreds of papers in this data set. Quite a broad variety of health-related or heat-related health outcomes, in addition to performance, productivity, and sort of the ones you might expect with heat, traumatic injury, as well as kidney injury and so on. And quite a broad variety of specific occupations, but the vast majority are really sort of general working age people. But for the paper that we wrote and hope to send in as soon as we can, we focused on outdoor workers, so agricultural workers, first responders, and construction. So subsequent slides are going to focus in on those. Yes.
What would you consider?
Yeah, that's a good question. It was driven mostly by the NIOSH folks. They were keen to look at this primarily, of course, and we were still in the last administration, but they wanted to look very closely at the farm workers and construction primarily. So from a big search, a big yield of about 7,000 articles, we boiled it down to about 900 that fit the combined cumulative hazard exposure definition, but focusing in further on the specific worker subpopulations that I mentioned. There were about 500 articles or so in that bucket, but not all of them really. We screened out quite a few for not having a heat measure, for example. So, there were some things that took a lot off the table, but the analytical data set in this case comes down to about 23 articles, over 100 statistically significant results, 19 countries, about half from US-based studies. And and now that we're writing the paper, and now it's second Trump administration, we wanted to look at funding and say something about funding, and particularly government funding for occupational health research. And so we were able to pull out a couple factoids that more than half of the articles that we described had some kind of government funding, and 35% of them were funded by NIOSH. I know there's a lot going on the slide. There's a lot of, so it's a big review. It's a diverse sample. There's a lot here. Our sort of the farm and agricultural side includes groundskeepers, all types of farm workers. There's, of course, those of you who've done some work in this area probably know there are many studies of sugarcane farmers and sugarcane cutters. in this literature that would be looking at heat. Some construction worker studies, a few experimental studies, and those were primarily the firefighters and first responders, looking at different combinations of PPE and exertion on some of the heat-related illness and immune outcomes, actually. Brick workers is one as an international study. And then there was an ecological study of working age people in ag intensive areas. So again, kind of mostly observational studies, a handful of experimental studies, one ecological research paper here. The heat measures also quite diverse, but mostly wet bulb globe temperature, right? At particular set points, and primarily, a common set point is 30 degrees C, sort of above below kind of thing. So plenty hot. And the second exposure combinations varied, and I'll show you in a few slides kind of the before and after. So what the criteria document had looked at, and then what this review kind of adds to the mix of considering this kind of cumulative idea. But so we have heat plus solar radiation, we have heat plus different types of work, we have heat plus different payment schemes for work, whether you get hourly work or whether you're paid piece rate. The usual handful of personal risk factors, including pre-existing disease and BMI, sex, years worked, and a few other things. And the heat-related outcomes that I've already described, the variety of heat stress, heat-related illness, heat strain, but also cognitive performance, and then things like that. Just a few examples on these next couple of slides to give you a feel of it. The highest risk we found in this data set was for sugarcane workers in Guatemala. It was an interaction study, and really only less than a handful of formal interactions in this data set, so much more stratified and effect modification. But this one was an interaction of work in heat, dehydration, and use of a non-steroidal anti-inflammatory drug. Really high increased risk for acute kidney injury in this particular study. Another one from the agriculture side, these were farm workers in California, and this one looked at the type of payment they were receiving. And this figure sort of captures in gold the piece rate workers, and then in gray the hourly rate workers and their exertion based on temperature, sort of their work effort based on temperature. And we can see that it is different. The piece rate workers tend to have higher activity when it's cooler, and quite a lot lower when it warms up. And the hourly workers also, you see that downward sloping pattern, but it's more even, right? It's not quite as extreme a difference. Here are a couple of examples from the construction side of this data set. And both of these studies were done in large workers' compensation databases, one in Australia and one in Washington State here in the US. And this first one, Ramesdeen, looked at different categories of workers at a construction site. And the heat issue in this particular study was a heat wave, so sort of multiple days of high heat. And they found civil engineers had more injuries. Yeah, I don't know why, than the other categories of workers that they looked at. The other one from Washington State looked at this one. The heat measure here was humidex, so that's heat heat and humidity, a certain type of index, and greater odds of injury per 1 degree increase in human index, and different by time of day, by type of injury, by worker age, worker experience, and then workers in small companies versus larger companies. The odds here sort of per 1 degree increase is very small, about 1%, right? But you can imagine that, in any particular day, there's more than 1 degree increase, right? So the risks are higher than it appears if you're just looking at these numbers kind of without thinking about it. But the Hopkins study was interesting for this cumulative risk idea, and Miriam Hopkins, in fact, I believe that she is still employed in NIOSH. She is at NIOSH now, and she also joined our author group for this paper, given that her research was really one of the most rich in terms of the sort of different types of cofactors, if you will, right? In addition to heat, that showed increase for injury. And so I promised I'd talk about what this work adds in comparison to the criteria document from 2016. And so we found research on all of those same factors as well, but also the piece rate versus hourly work, the work organization, size of firm, things like that. I didn't present examples of these, but perception of risk was also found in a couple studies to change whether sort of risk of heat-related injury. Also education. This one was interesting because, in fact, it was not intuitive, right? Or maybe it is intuitive. People actually with higher education tended to not attend to the heat, and were more likely to have a heat-related injury or illness. Okay, so just kind of taking stock on cumulative risk here. So, and research we're limited in research, right? And because we mostly look at one thing at a time. Sometimes we can look at 2 things at a time, sometimes 3 things at a time. That's really rare, right? Unless we're using things like indices and some of the newer statistical tools. So it's hard to come by research that looks at this combined risk issue, but it's there, right? If you look for it, you will find many types of combined hazard situations that lead to increased risk in many types of workplaces, sometimes very substantial increase in risk, and a wide variety of outcomes, relatively minor, shall we say, in terms of sort of comfort, thermal comfort, perception of comfort, that kind of thing, but all the way to very serious traumatic injuries and death. So kind of wrapping up, cumulative risk assessment. We don't do a lot of it. We tend to focus on stressors when we do. We have a hard time incorporating non-chemical stressors, other types of risk factors. We don't look very often to find at mental health outcomes, in fact. One big gap, right, that perhaps we can start to fill now that we have a framework for cumulative impact assessment is the lack of sort of risk mitigators, right? I mean, we would find this research if we looked for it. I think we have, I myself am also, guilty of just looking at stressors, right? But there is, there's resilience research. So there is evidence and there is research on risk mitigators and protective factors. So that's something that we maybe can start to build in a little bit more. Right now, of course, we're facing a very unfriendly political environment. for environmental and occupational health. I think this is not a priority for this administration. But we keep doing what we do, and I think we need to continue to build this data set, build this database. Perhaps we can learn from cumulative impact assessments that are happening in communities. And ultimately, I would hope that we can build this more into the top-down policy development. And I know that there has been interest in this, right? But it's not going to happen in the short term, I will say, unfortunately. I think that's, oh yes, some acknowledgements of NIOSH colleagues. A couple who may still be at NIOSH, but most not at NIOSH anymore, unfortunately. And some students who have helped with this, both working with the NIOSH colleagues who were in Cincinnati and here at Hopkins. And my initial funding for the work on the IDLH values was NIOSH funding. It was an IPA from NIOSH, but these most recent 2 review projects were funded through interagency personnel agreements, but funded by the Bloomberg American Health Initiative. Thanks. So other questions? Yeah, Kirsten. Right.
Maybe this would be asked for 2 papers that are gonna then, we're gonna not include their study to get things to come before.
Of interaction, right.
So I guess I was wondering from your perspective, like, you have a sense of this, like, is it often really like there just wasn't enough sample size and like stratifying? Also wondering if like just lack of statistical knowledge of how to actually do this, or what are like the barriers for students of getting more effects and more
Right. Right. So, yeah, well, interaction, that I think is just, it's not, I don't know. I think it's partly our research mentality. We try to focus in too much, right? And this idea is coming at you more from the policy side, which, here at the school, hopefully we're integrating that well through the Risk Institute, for example, but in other places, it may not, sort of thinking about policy in this way, may not be taught well, for one thing. Do I think it's sample size? Well, it could be. The range of sample sizes in this last study I talked about, the Health Plus, because I know it's on in the top of my mind now. I don't remember for the other one. There were some very small studies in this data set of like 5 people up to 30,000, right? So certainly in a very small study, and some of the experimental studies were, 10, 11, 12 people, you wouldn't be able to, statistically, you wouldn't be able to do it. So I think it's a combination of things. So, yeah.
What's the, how do you go about backing people when they're doing field risk assessment? I mean, I've had interactions with people that are like, yeah, we're going to do a cumulative risk or impact assessment, and they actually come out to be like a case five, where they're combining a bunch of different areas. And it's like, that's not what
we're talking about. Yeah.
And what references, or how do you go about having that conversation where you have to tell somebody that they're doing something?
Right. So this very recent National Academy study may be like our best resource to date on that. and in addition to that framework, right, they present in their report, I think it's like 8 different case studies of doing that accumulative impact sort of thinking across 8 different contexts, right? So I would, yeah, take a look at that report. Because I think that one that's probably the most valuable resource we have right now in one place to send somebody, right? Yeah, but just using an index is not what it's not what we're after. And again, from that recent report, the baseline context, right? That like being able to understand more like that the human population is not a homogeneous uh, animal study population, right? It's a totally different thing. And if we can understand more the pre-existing disease, right, and how that influences things, I think that'll be, as I said, major advancement if we can really get that happening. And that shouldn't be just at the community level. Actually, we need to do that, bigger picture in our national policy work as well. Anna.
Well, I was just thinking, I mean, I think one of the things that we're lacking sorely is a database that is actually designed for this, right? So if you're using NHANES, you have beautiful, very detailed exposure data, but not some biomarker data. Some questions about your occupation, not very,
Right.
some questions about the other exposure, but really not very good assessment of the exposure. And then you were mentioning that last one with the that we're looking at
The workers' compensation data set, yeah.
And that
Mhm,
you have
mhm.
maybe a lot of the exposure, but you don't have there. I don't think that you're gonna have a lot of the more detailed exposure, like biomarker or
Right,
measures.
right,
So
yeah.
how do you think there's a way that like a database or a way?
Well, I'll add another one to the,
Don't do a study.
right. Well, I'll add another one that doesn't measure up the way we want yet, and that's electronic health records, right? So, I mean, that, right, so getting more detailed occupational questions into NHANES, getting more detailed occupational questions into EHRs. Yeah, I mean, right, solving this one study at a time, right? We can bring forward examples, right? And data that show, okay, when you've got combinations, you get increased risk, right? But yeah, it would be great to have a more comprehensive database, right? Absolutely. Yes, Keith. Yeah.
Especially the funding of layman, but advanced audience. People would say that from or even anything.
Yeah, I don't have the answer to that one, I'm afraid. I mean, we all just have to communicate. We all just have to, talk to people. But as I said, right now, the environment is not good to I mean, within research, I think we can still make efforts, to advance things. On the policy side, we're not gonna get there, in the current administration. And so just, yeah, when you have an opportunity to talk to your family, to talk to people, right? Share some of this, some of these interesting things that you found, particularly if, they're in kind of a hazardous occupation, right? To flag that. Yeah, Kim.
You gave a good example last other week where they'll show that clip and they're like, this looks safe, free cold card.
Right.
The train, because they're doing a tree initiative to like take CO2 and everything. Right, but basically it's getting rid of like free cold card. I
Right.
think like that analogy helps that translation into the common person.
Right, right. Yeah, so, right, so thinking about this work, yeah, I mean, we probably could come up with some bullet points that sort of say, right, in, construction workers in this kind of context, yeah. We could put more more sound bites to it, but yeah, that was a good example of a tree planting initiative here in Baltimore City. And one of this was a clip we showed in the risk policy management and communication class. And so the mayor said, over time, this is going to remove, whatever it was, 3 coal cars worth of carbon from the atmosphere, kind of thing. So it's a very nice, packageable, understandable soundbite. I guess, okay.
But some of the newer methods for pictures, how do you see that heading into the cumulative risk assessment? A lot of policy making is still a single chemical at a time, but then all of a sudden it's pesticide mixture.
Right. So I'm still trying to figure out. Can we ask Kate that question? I'm still trying to figure out what some of these more complicated statistical methods and multi-chemical indices can mean. And you'll see, just sort of thinking about TSCA, right? In the TSCA program, they designed that mixture. They said, okay, we're preparing a report. It's got 6 phthalates in it, and we're telling you the 6 that are in it, right? I mean, it does have the biggest ones in there, right? But it's not all of them. And yeah, I can say this, right? Our policy structure is not set up to do it, right? I mean, in the simplest terms, we can potentially, and I've thought a little bit about this more, not from kind of chemical mixture side, but more from sort of community social determinants of health side, like we sort of build in another modifying factor, right? So for communities that we know are going to be at high risk of a certain exposure, we reduce what's acceptable for them even further, right? Than we might. I don't know, maybe there's something we can do, something like that with when we're thinking about the bigger chemical mixtures as well.
Yeah, I guess is there any consideration if you're regulating one solvent, and then there's 9 papers out there that say, oh, but when it's in this mixture, it's maybe even worse. Would there be any consideration for this common? We're going to regulate one, but we know you're probably exposed to a lot. No, there's actually some evidence for it.
Well, there are little examples of that, and most of them come from the occupational health side, right? The first example I know of an occupational exposure limit that was set on the condition of a second exposure actually was carbon monoxide and methylene chloride, right? So this was back in 1976 that the standard came out that if there's a co-exposure, right, you have to, you have to be more, you just have to be more careful of it, right? And you can't have both at the same time because they, person's not gonna be able to breathe. Yeah. So there are 2 or 3, examples of things where, and again, for the ototoxicity as well, that was relatively recently, right? So NIOSH is thinking about this, but we don't have a lot of examples, but there are some precedents. So I know Keith was waving me down, and Kirsten had her hand up too. Yeah.
I was too. You should who are gonna be thinking about the political context, their administration, had to say personal responsibility to right here. The company could say, well, it's not our fault, we smoke. Whatever. We're the what to go with those workers are.
Well, so actually, yeah, and I meant to mention total worker health before this, but I mean that, total worker health, it hasn't, I thought that's a cumulative risk thing. I'm like, yay. Again, it's taken some incremental steps, right? On behavioral things like smoking, I think total worker health is sort of where we might have some leverage there, right? Now, conceptually, we still have total worker health. Do we have support for it? Probably not. Not much going forward, but as a concept, it's still there. I think we have to, in the near term, for those of us who have employer partners for different things, I think we should be talking to them. And I know, right, there's under the auspices of our Total Worker Health Center, there's been conversations with Amazon about occupational health effort. So, I would applaud that, right? It's certainly not something that I have done much of, but I think it's the thing to do right now. I think we're at time, right? All right. Well, thank you all.